Paul Neeson with the Raw Life Health Show. Here's part 1 to an interview I did with this week's featured guest, Gordon Tesler. Now, if you want to see the whole video, it's over an hour long. Just go to the Raw Life Health Show and sign up as a member, and you can check it all out. That's rawlifehealthshow.com. And if you're already a subscriber and watching this, you get to see part 1. But to see the full video, you got to go check out Raw Life Health Show and become a member. All right? So enjoy this week's video, the featured video. Here it is right now. And if you have any comments or questions, remember, post them below the video.
Well, hello, everyone. I am Dr. Gordon Tesler. I have a PhD in nutrition. Actually, Paul, how I got into the field in the first place was back in the early 60s when I was a senior in high school, actually a junior in high school. I had psoriasis growing up all through my, I would say from about 10 years old on up. And somebody in high school gave me a nutrition book, and it had a chapter on psoriasis. And it said that if I would give up eating dairy products and give up eating animal flesh, that my psoriasis would improve, that it was really related to my liver not handling fats. So I was 17 years old, and I was desperate. And so I decided to change my diet. And lo and behold, after about 6 weeks or so on this program, most people would rather die, Paul, than give up dairy products and meat. But I wanted to live, and I wanted to live in a healthy way, even at a young age. So in 6 weeks, Paul, about 90% of the psoriasis on my body went away. So I went back to my dermatologist, and I asked him, why didn't you tell me about nutrition having anything to do with psoriasis? And he looked at me and he said, Gordon, you're a very intelligent young man, and you and I know that what you eat has nothing to do with disease. And when he said that to me, I had a choice to make. And that choice was, do I believe my doctor or do I trust my experience? And I decided to go with experience. And therefore, I got into nutrition. I started to read everything I could get my hands on. In the early 60s, there weren't many nutritionists around. There was Adele Davis, there was Paul Bragg, and there was Bernard Jensen, Dr. Pavel Irola. And I began to read these people's work. And also I read Arnold Ehret's The Mucusless Diet Healing System, and Johnny Love Wisdom's the Fruitarianism. And so I got into all of this kind of raw food, veganism, way before it's been popular today. And so I've been in the field a long time, and I started practicing on myself, which is the way to always begin. I think you'll find that most people that are in the nutrition and health field were sick, and they went the traditional route, the medical route. It didn't help. So then they started to look at the non-medical route, and that's what really helped them. So that's what got me interested, and God has seen fit to keep me in the field. I met Dr. Bernard Jensen in the early 70s, and I met Dr. Pavel Irola. And if people don't know who these names are, they need to read their books. Dr. Pavel Irola, in my opinion, was one of the real forerunners of the nutrition field. Of course, I've read a lot of other people. Let Food Be Your Medicine, excellent book. And there's several others that have probably come to mind. But Dr. Irola and Dr. Jensen did something that was very interesting to me, Paul. They traveled around the world studying healthy people. If I was going to tell people what they should eat, I wanted to base it on something more than just an opinion of an author. I wanted to base it on good scientific data of people that have lived long, healthy lives free of disease. And so what happened was that when I read about the Abkhazians of Georgia, Russia, I read about the Vilcabambas of Ecuador, I read about the Hunza people, and there's others. They had some things in common, Paul, and those are the things that I put together in my books. And one of the common things that I noted, and this is something that kind of blows up the all raw foods way of living, although I'm 100% for eating raw foods, the healthy cultures that I studied, 80% of their diet was cooked. Now, it wasn't the kind of food that we eat in our grocery stores. It was organic. It was live food, but they did cook it because they lived, Paul, in areas that were 5,000 to 7,000 feet above sea level. So it was pretty cold. So the number one food in all healthy cultures that Dr. Arola and Dr. Jensen studied, 50 to 60% of their foods came from grains, legumes, and beans. And if you studied any one of these cultures, you'd find that one grain would stand out. For instance, with the Hunza people, it was millet. And it was also millet with the Abkhazians in Georgia and Russia. And that was their staple grain. And of course, now we know about millet that it's one of the most concentrated forms of natural protein that you can get, equal to meat, having all the amino acids in it. And so, as I began to study, I realized that about 30% of their diet was vegetables. So if 30% is vegetables and 60% is grains and legumes and beans, what's left? Well, what's left is fruit, and fruit only represented a very small portion of their diet. They were not fruitarians. They had maybe a couple pieces of fruit a day. And then we get down to meat and dairy products, which only represented about 4 or 5% of their diet. And many of the cultures didn't eat dairy or meat at all, and those that did, they didn't eat it every day, not even every week. It was mostly once a month for a festival or religious holiday. So that was my template, if you will, these healthy cultures. And I began to emulate them myself. I was a strict vegan vegetarian for, 10, 12 years where I didn't even use leather shoes. But it didn't strike me that it was a good idea to use synthetic shoes. My feet sweat a lot in synthetic materials. And so I went back to using leather. But for a good 30 years, I was a vegetarian. I didn't eat eggs. I didn't eat milk or fish or any of that kind of thing. And so during that time, I met Pavel Irola and I met Dr. Bernard Jensen. And they began to input into my lives. I began to study iridology. I was a personal student of Dr. Bernard Jensen's, and he taught me how to read eyes. And of course, he had seen something like 300,000 patients and really had a tremendous amount of information to give me. And I got a camera and I took pictures of people's eyes, and I did this for about 10 years. And Dr. Pavel Irola, when I met him, he offered to allow me to go to work for him and write some of his articles and so forth, and kind of, because we were on the same page, even though he was in his 60s and I was in my early 30s, we were still very much on the same wavelength. And I really, really respected Dr. Pavel Irola. I felt wherever I had a question, I could always call him up, and he would give me a very sound answer. And he'd always tell me, Gordon, don't just jump on the bandwagon of every new health product that comes on the market. Wait 2 or 3 years and see if it's still around after that time. And I've kept that in mind always, because I'm very impetuous and I jump on new things when they come out. And of course, there's new things coming out now every day, and it could drive you nuts. So what I did was I got a foundation with 2 teachers that had counseled many people, that had studied healthy cultures, and I got a foundation of what healthy people eat. And then something very, very important happened to me in 1986, 85 actually. I came to meet Jesus Christ, Yeshua HaMashiach, as my Lord and Savior. And that's another story. If you want to get into it later, we can. But that really changed my focus, because as a believer now, I came from a Jewish family, and a secular Jewish family, and Jesus Christ was a curse word in our family. But when I met him, I realized that he was the Messiah, and I began to start reading the Bible. And as I read the Bible, I found that there were foundational principles of health in the Bible. And lo and behold, Paul, they matched up with what healthy cultures were doing. Some of the healthy cultures were doing.
This is the Raw Life Health Show. Raw Life, brighten up your life.